Next bill we will hear today is House Bill 156 with Representative Dotson. If you would, make your way forward with any testimony that you have with you today. If you don't mind, go ahead and state your name for the record and begin.
Absolutely. Representative Myron Dotson, 9th District. Thank you, Mr. Chair and ladies and gentlemen. 2 years ago, we passed legislation to allow for essential caregivers in our nursing home hospitals to allow family members to be able to visit loved ones that may be in one of these type of facilities. In doing so, we forgot psychiatric facilities that would treat as well, private psychiatric facilities. We did include the state-run, but House Bill 156 will guarantee that essential caregivers will go into these type of psychiatric treatment centers which handle children from the age to 4 to 21. I've had 2 young people that have families have reached out to me over the last 3 months that their children were taken to these, placed in for 72 hours. They're under COVID lockdown and no ability for any family member to see that child. So
Okay. We do have a motion on the bill.
Absolutely.
We do have a motion and a second. Do we have any discussion before we take a vote? Seeing none, clerk call the roll.
Representative Bentley?
Yes.
Representative Bratcher?
Yes.
Representative Bray?
Yes.
Representative Burke? Representative Callaway?
Yes.
Representative Dotson?
Yes.
Representative Duval?
Yes.
Representative Frazier Gordon?
Yes.
Representative Justice?
Yes.
Representative Neighbors?
Yes.
Representative Rayburn? Representative Raymer?
Yes.
Representative Riley?
Yes.
Representative Rourks?
Yes.
Representative Sharp?
Aye.
Representative Swan?
Yes.
Representative Weber? Representative Wilner?
Yes.
Representative Whidden?
Yes.
Chair Mosier?
Okay, we have 17 yeses, no zeros. It does pass with favorable expression. Same shall pass on the House floor. Thank you.
Thank you, Mr. Chairman. Thank you, committee members.
Okay, next we're going to have House Bill 196 with Representative Ken Fleming. There he is. I was looking for you behind the pole there. If you would, just state your names for the record, and then you can begin your testimony.
Thank you, Chairman. Appreciate it. I'm Ken Fleming, represent the 48th District, which includes part of Jefferson and Oldham County.
Good morning. I'm Liz McCune. I am a licensed psychologist and Chief Operations Officer and Vice President at U of L Health Peace Hospital.
You also have someone on Zoom, correct?
I do not.
You do not? Okay. We do have a committee sub.
We do.
Okay. I'd like to take a motion on the sub. Second. All in favor? All opposed? Okay, committee sub, Pat.
Great. Thank you, Mr. Chairman. Thank you, ladies and gentlemen, the Family Health Services. The committee sub was very, very simple. It actually just inserted a couple words, so it's not monumental. It's just more of a clarification between University of Louisville and U of L Health. So that's basically all it is. But let me go and talk about the bill itself. A couple of years ago, or actually about a year and a half ago, I was reading an article in the Wall Street Journal, and toward the end of the article, it basically talked about an app that goes on phone devices whereby middle school and high schoolers can access mental health professionals 24 hours a day, 7 days a week for crisis intervention. Since that time, I have worked with several legislators in University of Utah. I'm not University of Utah, but State Utah, the General Assembly members, as well as U of L Health. And I just want to put a plug about U of L Health. They've jumped in at the very beginning to help cultivate and get this to where it is today. And this is really a dynamic, and I think a pretty much of a needle mover when it comes to helping our kids out when they come across a very significant crisis situation. What this bill does, which is 196, it establishes the Kentucky Health Safety Center, which is basically called Safe KY, Safe Kentucky, and it basically is off of the Safe UT or Safe Utah. In addition, it creates an advisory board to guide, counsel, and provide a resource for U of L Health. These members basically come across from a wide spectrum of disciplines, and basically those members of those council is outlined in the bill. It enables Safe KY to create, implement, and maintain an app for middle and high schoolers, college students to access mental health professionals to help divert crisis and provide some guidance. It also has a good reporting requirements so when they can come back and show us how things are being successful and so forth. But their ultimate goal is to go through a pilot project for this coming year or this year and then implement this throughout the state. We do have a couple of schools that are interested in this. And then U of L Health will basically cultivate those relationships as well as law enforcement to help those things out. So I'm going to have Liz sort of give a little more detail about the Safe Kentucky.
So thank you, Representative Fleming. Safe KY will be an app that is loaded onto a phone, and through that app, an individual, whether that's a student, whether that's a parent, whether that is a school official, will be able to text anytime they have an emergency concern that may involve mental health. If they become aware that a student may be aware that there's a weapon on campus, or if they are having thoughts of self-harm or harming others, they can send a text. We know with our youth that text is the preferred form of communication, and currently 89% of teens carry a cell phone. So this would be an opportunity for them to reach out. We would have a licensed person on the other end of the text. They can reach out anonymously. We would then connect them with either law enforcement or school officials or a trusted adult, maybe a parent or other adults, so that they can then help in resolving the crisis situation. This is meant to be an extension of school personnel and an extension of emergency services in getting these kids connected in order to prevent any major catastrophic event. Currently, the Safe UT program that we have been working with handles about 32,000 inquiries a year in which they have worked to reduce acts of suicide as well as become aware of weapons and hopefully prevented any catastrophic events.
I also want to add, Mr. Chairman, that this basically complements 911 or 988, I should say. Basically, sometimes it's hard to remember a number. All the student does is they're basically face plant in this thing right here, and they basically have this app right there in front of them where they can go and access a mental health professional. So that's really a really good benefit, and once again, it complements the 988. The other thing I want to mention.
We have a motion on the bill. You want to finish your thought? Go ahead.
Yeah, if you don't mind,
Go ahead.
because I think this is really a monumental thing that you're voting on today, because a lot of these calls come in between 11 p.m. and 3 a.m. And sometimes, we're parents and we're sleeping, and so they will call this app, make sure that things are taken care of, and so they address the student and their needs and so forth. So, so I just want to make sure that this is a monumental thing that you're voting for, and I think it's going to be very implemental. And very important for the life of our kids.
I do have a quick question, and you answered it in part. Going back to the 988, how does that interface with the app itself? How does that correlate together?
So we've talked with some of the 988 representatives in the state. We currently have 10 different call centers that answer 988 calls. Only one or two of them at this point are able to take texts. And since this is designed as a primarily text and chat feature, it's meant for us to become aware of that. And then we can also loop in the 988 or 911 services if needed.
Gotcha. Thank you.
So it's meant to work in conjunction.
Thank you. I do have a couple questions. Representative Bentley?
Thank you, Mr. Chairman. I want to compliment the U of L Health for putting the money forward to do this. I ran the same bill 5 years ago and couldn't find any money. Yeah. And the president of the Senate in Utah is a good friend of mine, so I hope y'all do a good job. Thank you.
Thank you.
Thank you. I have another question here. Representative Winton?
Thank you, Mr. Chairman. You all talked about the anonymous nature of it, and I think that that's important. Can you speak a little bit about how they can be assured of the anonymity?
Sure. We do not collect any information at all when answering the phone, nor do you have to put in information to register for the app. If we became aware that someone had threatened harm on others, we can pass along the IP information to law enforcement, and they can then, through their channels, try to discover if it is a privately owned phone, where it may be coming from. But otherwise, there is no, it ensures anonymity, and I think that's part of the appeal and why students feel comfortable in reaching out.
Thank you.
Any other questions? Okay. Clerk, call the roll.
Representative Bentley?
Yes.
Representative Bratcher?
Yes.
Representative Bray?
Yes.
Representative Burke? Representative Callaway?
Yes.
Representative Dotson?
Yes.
Representative Duval?
Yes.
Representative Frazier Gordon?
Yes.
Representative Justice?
Yes.
Representative Neighbors?
Yes.
Representative Rayburn? Representative Raymer?
Yes.
Representative Riley? Representative Rourks?
Yes.
Representative Sharp?
Aye.
Representative Swan?
Yes.
Representative Weber? Representative Wilner?
Yes.
Representative Whitten?
Yes.
Chair Mosier?
Looks like we have 16 yeses, 0 no votes, and House Bill 196, as amended by House Committee Sub, passed with favorable expression. The same shall pass on the House floor.
Thank
Thank
you,
you.
Chairman, and thank you, ladies and
Great
gentlemen,
bill.
for a
Thank
historic
you.
moment.
Okay, now we're going to be calling House Bill 311 with Representative Rebecca Raymer. You have any guests with you? Okay. If you would, Representative, make your way to the table and give us your name for the record, and also your the name of your guest on Zoom.
I'm Rebecca Raymer, representative for the 15th District, and I believe I have Claudia Tucker, who's with Teledoc via Zoom.
Good morning. This is Claudia Tucker. I'm here.
And I think we do have a committee sub.
Do have a motion and a second on the sub. All in favor say aye. All opposed? Sub does pass.
Okay, so House Bill 311 is really a technical fix. It is going to clarify that in order for somebody to be a Medicaid provider, they do not have to be physically located within the state. They still have to be licensed. They still have to have a Medicaid.
We have a motion and a second. Would your guests like to share? I hate for them to take their time and not be able to say something, so.
Thank you, sir, members of the committee. I'm just here as a subject matter expert. Should the committee have any questions, this is really a cleanup bill, and it will go a long way to improving access for the Medicaid patients there in the state.
Thank you so much. Okay, clerk, take the roll.
Representative Bentley? Yes. Representative Bratcher? Representative Bray?
Yes.
Representative Burke? Representative Callaway?
Yes.
Representative Dotson?
Yes.
Representative Duval?
Yes.
Representative Frazier Gordon?
Yes.
Representative Justice?
Yes.
Representative Neighbors?
Yes.
Representative Rayburn? Representative Raymer?
Yes.
Representative Riley? Representative Rourks?
Yes.
Representative Sharp?
Aye.
Representative Swan?
Yes.
Representative Weber? Representative Wilner?
Yes.
Representative Whitten?
Yes.
Chair Mosier?
Yes.
House Bill 311. House Bill 311 passes 16-0,
Thank you.
and the same should pass on the House floor. Thank you.
Thanks.
Okay, for those of you that have came over, need to be recognized for votes. If you would, go ahead.
Mr. Chair, if I could please register a yes vote on House Bill 156, a yes vote on 196.
Thank you. Are there any others? Okay, now we're going to call House Bill 349 with Representative Dan Bentley. If you and your guests would come to the testimony table, state your name for the record, and you may begin, sir.
Have a seat there, Michelle. Can you get in there? Yep. Thank you, Mr. Chairman. My name is Danny R. Bentley, District 98 of the great Commonwealth of Kentucky. You want to introduce yourself?
I'm Michelle Rose. I'm a research scientist.
Wait a minute. Now.
Hi there. I'm Michelle Rose. I'm a research scientist for population health with Norton Healthcare in Louisville, Kentucky.
House Bill 349 is a combination of three bills, put them all into one. It's an act relating to the treatment of sexually transmitted disease. The bill does three things. It expands partner therapy to include but not limited to gonorrhea, chlamydia, and trichomonas. It removes felony offense for people with HIV who donate organs or tissue.
I have a motion on the bill. Do I have a second? Got a second. Representative Bentley, do you want to continue? Or?
Just one more statement.
Sure.
Allows HIV self-tests to expand access, which is good. Now, please give Michelle just a minute
Sure.
to speak. She's came all the way from Louisville.
I love this bill. It's a great cleanup bill. It aligns Kentucky with what's happening on a federal level.
You come a little closer to the mic.
Sure.
There you go.
Yeah, so I just saying I really love this bill. It's a great cleanup bill. It aligns Kentucky with what's happening on a federal level. Self-testing for HIV was federally approved in 2012, and then expedited partner therapy was recently updated by the CDC. It's a great way to address the STI epidemic in the United States, where 1 in 5 people are walking around with an STI in any given day. And then lastly, in 2013, the federal government updated its transplant from non-HIV to HIV. This is called the Federal HOPE Act, and Kentucky addressed that in its organ donation through uniform administration. So it's definitely a cleanup bill, and I really appreciate everyone's time.
Does any of the committee have any questions? Clerk, please call the roll.
Representative Bentley,
Yes.
Representative Bratcher,
Yes.
Representative Bray,
Yes.
Representative Burke, Representative Callaway,
Yes.
Representative Dotson,
Yes.
Representative Duval,
Yes.
Representative Frazier Gordon,
Yes.
Representative Justice,
Yes.
Representative Neighbors,
Yes.
Representative Rayburn, Representative Raymer,
Yes.
Representative Riley, Representative Rourks,
Yes.
Representative Sharp,
Aye.
Representative Swan,
Yes.
Representative Weber, Representative Wilner,
Yes.
Representative Whidden,
Yes.
Chair Mosier.
Okay. House Bill 349 passes with 16 yes votes, 0 no votes, and the same should pass on the House floor. Thank you.